So Wild Health does genomics-based precision medicine. So what that means is our goal is to optimize the health and health span of our patients. So we do that by sequencing their DNA, looking at microbiome, blood work, a long question and conversation, and then we combine all that to come up with a plan to truly optimize you. So to get to your best health now, and then keep it that way and maximize your health span. We'll keep you as healthy as possible for as long as possible. When the pandemic hit, our goal was to optimize the health of our patients, and we couldn't do that when they couldn't get COVID tests. We just happened to be very fortunate to be in a position where we had a lab, we had scientists, and we could run the CDC tests. So we started doing that just to meet that need for our patients. What happened is because everyone else wanted it as well, other people started asking us to test for them. A lot of different companies in the area, and it just grew and grew until eventually we were very fortunate and very excited to get to work with the University of Kentucky. It was difficult, but it was necessary. Like, there just weren't the tests. Like, if we didn't do it, people weren't getting tests. And so we felt a responsibility, we had the ability. Dr. Murray ramped up really quickly, and we had great partners. That's what made it easy. At first, it was a real struggle. The University of Kentucky's done a great job in vaccinating a large percentage of the population. So many other hospitals and pharmacies and places are vaccinating the state. It's just such an important thing to do right now. One of the more difficult things is to vaccinate in the rural areas. There's a little more vaccine hesitancy, and it's just harder to get there. There's not the density of population. So that's a difficult thing, and again, it's kind of a progression. It's a need that was there. We have the people and the resources to be able to go to those places, so we've been going into the rural areas.
We've done about 50 sites, 40 to 50 sites. Those sites started with the folks that were already using testing from us. They said, hey, once you get the vaccine, can you please come back? We've been to about 20 of them so far outside of Laurel and Henderson County. We're trying to get to the absolute furthest away places we possibly can to vaccinate the folks that are hardest to get to.
The mission of Wild Health is to optimize our patients' health and health span. And right now, in the pandemic, the best way we can meet that need is with testing and vaccination. As soon as that need is over, then we'll get to go back to our deep science roots of genomics-based precision medicine.